Chadia Wannous with us here. A piece of this whole discussion that gets, I'm noticing, gets consistently less attention is the animal health, domestic animal health piece of the story, which is an absolute key piece of the risk as well. So we're very happy that Chadia is with us. She's the One Health Global Coordinator with the World Organization for Animal Health. Chadia, thank you for joining us. Talk a little bit about, first tell us, what is the quadripartite? Because I don't think everyone here knows what that is. And what is its One Health joint plan of action? Why is it important? How do you see it helping to reduce the risk of future pandemics?
Thank you so much for having me. Thank you for the invitation, both you, Nigel, and Kim, and to be on this panel with the wonderful women. It's good to see this gender represented here in the COP, because we have seen so many only men panels. So to talk about the quadripartite, it's exactly what my colleagues have said. It's about collective actions, collective responsibilities. So we have to come together and we have to form alliance and collaboration to be able to achieve the impact that we are looking for, which is to reduce the risk, to prevent the pandemic from happening in the first place. And while doing this, we have to optimize the health of all species on Earth, for animals, for humans, and also the environment, to preserve it and protect it, biodiversity and ecosystem integrity. So it's a collective effort to be doing this. We have started this One Health working since at least 2004 or 2000 maybe,
yes,
with the Manhattan Principles after the SARS outbreak. But then we formalized the collaboration between the tripartite at that time,
yes,
WHO, FAO, and WOHA or OIE at that time, in 2010. And we decided to work on three priorities. It's AMR, antimicrobial resistance, avian influenza, of course, because it was a major issue at that time, and now it's coming back, and rabies, because it's one of the neglected diseases that have huge burden in developing countries, and we are not doing enough, and it's zoonotic disease. And then working on this and understanding better the One Health approach. What does it mean to One Health? It's not just animal health and human health. We have the environmental component missing. And that's why we need the environmental sector, the wildlife sector, to be partner with us. And for that, we expanded our tripartite to form the quadripartite. And we are very happy to have with us the UN Environmental Program,
yes,
as equal partner in this collaboration. So we are addressing this issue of environment and wildlife and drivers, biodiversity loss, from the perspective of environment sector and conservation, not just human or animal health perspective. So this is after this we have this collaboration last year signed. Because of the COVID-19 pandemic and the interest in One Health, as Christina said, everybody now is talking about One Health. There was a request from member countries for these four organizations to develop a One Health strategy, where all of them will be sharing the responsibility to support countries, each with their respective mandate. So we work together almost 1.5 years now to
yes,
develop this One Health joint plan of action with the drafting teams from the four organizations, and we come up with a plan that's practical, that's feasible, and we all behind it. And in this plan we have 6 action tracks. So of course we have to talk about reducing the risk of pandemics, but also we don't forget neglected zoonotic disease, vector-borne disease like malaria and Rift Valley fever and others. not because we don't have them here, so we don't, in the Western world, that they are not important in our agenda. And then we have AMR, of course, the silent pandemic, not so silent because it kills millions of people. And then we have food safety there. Thank you, Christina.
Sorry.
And we have, importantly, an overarching action tracks on building the One Health core capacities or the One Health workforces. So it's animal health, human health, and the environment workforces. It's not just human health or public health workforces to respond to the pandemic after it happens. And importantly, also we have the environmental action track. So we have developed this objective aligned perfectly with the biodiversity objectives that we have seen in the Global Biodiversity Framework to protect and preserve the ecosystem, the environment. And to do this, we have identified 4 actions under this. One of them to jointly train our workforces. So you go out of the university, undergraduate, and you understand very well what do we mean by One Health and how to do it while you are in the field. And we also need the data, the evidence from the climate, from the weather, how this climate is impacting us as humans and impacting the animals, and why the risk is increasing if we have heat waves or floods or drought, and providing this evidence to policymakers so they take the decision to invest in reducing this risk by working on the drivers, on the upstream prevention, as you said, the primary prevention. So I think it's a wonderful opportunity for us to capitalize and leverage this momentum from the pandemic and to start working on One Health. And the next step for us is to have this implementation handbook outlining those 3 pathways of change. The first one is to have the enabling environment to do this One Health jointly. What kind of regulation you need, what kind of financing, advocacy, political buy-in. And then the second one, it's about implementation, how to implement it, what kind of coordination mechanism, institutional arrangement needed at the country level or at all levels. And the third one, it's about the knowledge, how to get the traditional knowledge, the indigenous people, the communities invested in it and supporting this work and really be part of the One Health. So I stop there. Thank you.
Thank you, Chadia. Thank you. That's fantastic. I think you just answered all the questions I was going to ask you, which is very good, very helpful. We'll come back.